Okay guys, so to those who didn't watch the first video, I basically got diagnosed with testicular cancer late February and I got surgery done. If you want the full detail on that part, you can go and search for the I have cancer video. This is basically an update because there's been a lot of you who's been wishing me well and you've been sending me messages asking how am I doing. Thank you so much. And today we are here in Sunway Medical to take the results and see what the doctors say about what I have and next step.
So you have what we call testicular cancer. The histology is seminoma, classical type. Basically, it's the most common type for testicular cancer and it's highly curable because most of the time presents at an early stage because the testis is outside the body and you can feel it. And so when they have a mass there, usually it hasn't spread. Most important treatment of course is surgery. But the problem with testicular cancer is that we also know that it can spread to the lymph nodes in the para-aortic area. Alright, because developmentally when the testis first develop, it's actually inside the body, okay, in the embryo, and then it migrates down into the testis. And during that migration, the blood supply for the testis actually comes from the aorta, the upper part of the body. So the lymph nodes, the drainage and all that pattern of the testis actually goes up to the para-aortic area. Okay, so a lot of times when you first come back, it's in that region. But of course it can go beyond and spread elsewhere as well. So you remember when you had your operation, the surgeon didn't make a cut in the scrotum, but your cut is actually in the inguinal area.
I was surprised.
You're surprised, right? You know why? Because they do not want to disrupt the lymphatic pattern of spread in that region. So they have to actually cut here and pull the testis out from there so they don't contaminate the lymphatic channel down there. So the spreading pattern will not change. It will go still up to the lymph node around this area. So traditionally how we treat this is that after surgery, we will give radiotherapy to this area. For many years we have been doing that, but what we found out is that yes, we cure a lot of patients, but they can get problems because of the late complication from radiation. And then what came next is that why don't we give patients chemotherapy instead? Okay, and this drug that we use is carboplatin, and we give it usually just for 2 cycles, and that is to kill away any possibility of cancer that may be hiding in the lymph node region. And this has been actually shown to be as effective as giving radiation to the lymph node region. So that is one way we can do. The other possibility of this cancer, as I told you from the very beginning, is that it's highly curable and most of the time very early in presentation. Alright. The problem with this is that when it recurs, it can happen many years later. Even in the next 8 years or so, there's still a chance of it coming back. And we do not have a simple test to test for it, i.e. there's no cancer marker. Even when you take blood and all that, you do not have a marker for it. So it can only rely on scans. We do not want to keep doing scans for you, alright? Because if you do scans means that every 3 months or so you need a CT scan and all that. Even MRI will be very troublesome as well. Alright, CT scan, you're worried about radiation. One other option that we have will be close monitoring and surveillance, which you have a choice for that as well if you want. Alright, but if you do not want to do that repeated scanning and all that, then the simple way will be to go for the chemotherapy. Okay, but all 3 are valid options.
Chemotherapy, right? I still have to come back for a checkup, but I don't have to come back so often.
Absolutely. Basically, you would still have to come to check up because we also worry about the other testes. So we have to, feel and palpate the other testes and do a physical thorough examination each time we see you. And of course, you still need a scan, but most likely it will be a yearly scan. Alright, if we do blood tests, is to look for any potential side effects as well. Of course, we'll still monitor your tumor markers just in case. Alright.
Okay. And before chemotherapy, you suggest that you go to a sperm bank.
Yes, correct. So I mean, one of the reasons is of course, as with any chemo, we are worried that we may potentially cause problem to the other testes that you have. That's the only one you have left. Alright. So, and the other possibility is because some patients with germ cell tumor, this group of cancer is called germ cell tumor. You may have inherently some problems with the sperm production and all that as well.
Yeah.
So it's better to keep it safe just in case. Right, so we'll want to keep your sperm there just in case that if there's any problem later on, you can use it.
Yeah.
Okay.
Okay. So out of the 3 options, you suggest the
Yeah,
chemotherapy?
I think, well, to me that will be a very easy and straightforward treatment, because this chemo that we are using, it's actually very mild, very gentle, and most patients are very well. It doesn't cause hair loss. There's very little nausea or vomiting.
Yeah.
In fact, the patients can go back to work, most of them, and it's only for 2 cycles. All right. So it's I think it's a very simple, easy treatment, and rather than having worried that you haven't done anything, the anxiety of coming for repeated scans for the patients,
Yeah.
I think it's quite scary.
So what normally causes the hair loss?
Okay, certain drugs cause hair loss. Not all chemotherapy causes hair loss. All right. So the reason is that chemotherapy affects cells that grows and replicate very quickly. All right. So the different ways that chemotherapy works. All right. So some chemos, they are very strong and all that, they can cause hair loss. But hair loss is temporary, and the hair isn't just from the scalp. It's actually whole body. You can even have hair loss. The pubic area hair, your armpits, all this hair can drop as well. But these are all temporary.
Right.
Okay, so the reason for the hair loss is because the hair follicles that are growing are being suppressed. So when the old hair, which are mature hair, drop off, they are not being replaced. Okay, and once you stop the chemo, the hair follicle will start growing again.
Right.
So that's all. So it's nothing,
It's not like the end of the world.
Yes.
Okay.
Okay, so it's the same thing with some chemotherapy will cause myelosuppression, what we call suppressing your red blood cell, your white blood cell from producing the same thing. The mature cells are, it's not affected. But when you give chemo, it affects those cells that are growing. Those immature white blood cells are not being produced.
Yeah.
So when all the mature white blood cells die off, they are not being reproduced fast enough.
Yeah.
That's what is happening.
Okay.
But a lot of chemo drugs that we have nowadays actually are not very myelosuppressive. So it doesn't cause the white blood cell and all that to drop very much.
Right.
Okay, for example, carboplatin,
Yeah.
all right, which is what we're going to give you.
So we just finished visiting the fertility clinic. Basically, she just told us that after he does chemotherapy, the chances of him reproducing in terms of
Basically, no more sperm lah. After chemotherapy, there won't be any more sperm. That's why we have to be at this fertility clinic. It's actually a sperm bank. On Friday, I'm going to come to the hospital to just put my sperm in the bank. Yeah. So in case if we want to have kids in the future, then at least there's a
another option.
Yeah, there's a precaution lah. Monday I'll go through chemo and it'll basically wipe off everything. So keep us in prayers. We'll keep you updated soon, and we'll probably bring you guys in through the chemo process as well. I mean, the reason why we even update all these things, which is very, very personal, I feel, is that based on the response from the first video, I'm very glad that some of you actually went to check out, went to see a doctor. If you were, diagnosed with it, I hope you caught it early, just like I did. I want this update to sort of not scare people away, because it's normal to feel very scared when you hear chemotherapy. This is to educate the public on what it is. And once again, just shout out to Cancer Research Malaysia, because if they succeed in making a vaccine, none of us have to go through the whole process. For now, we'll bring you through what it's like. Keep us in prayer, and we'll update you soon. No mood to do call to action now, but subscribe to this channel, because it's probably the only thing that's gonna fund the whole process. And yeah, support us in any way you can. Buy a shirt. Yeah. See you guys.